Yes. I think that's good. I think we'll talk about how you're feeling. Have you been doing the handouts that I've gave you? Well, as always, you know, I am a fellow depression sufferer, diagnosed, been hospitalized for over 30 days, multiple different modalities of treatments, medications, everything. And I'm also a physician who's treated patients with depression, so I kind of understand both sides of the table, and I understand some aspects of things that people, a lot of people maybe don't know, things that, like little hidden background things. So, yeah, this is Ginger. She likes you. You want to pet her? Here, you can pet her. She's so soft, isn't she? Yeah, she likes you. She wants to look at your face. Careful, she's a lip biter. That's why she's looking at my lips too. Like she kind of wants to. Yeah, she says, she's biting me now because she wants me to put her closer to you. Animals are so sweet, aren't they? I actually am getting her registered, just like my other two birds, as an emotional support animal. It is possible to get your animals registered, but the United States, under the Trump administration, changed it so airlines no longer have to honor emotional support animals. I think you should write into your congressman about that. I definitely wrote into mine because especially for little dudes like this and for veterans, it adds nothing to the airline if a tiny little dude is under. Let go. No. This lipstick has not been tested on animals, which means that I don't know if it's safe for you, so you can't have any. I mean, it's also a good thing, right? I really like Shiseido, even though it's not cheap, but you know, it's Japanese and I'm Japanese, so. Alright. So yeah, emotional support animals. You can get registered with your therapist. It's definitely something to ask about. And there are actually online services with therapists who will help you get registered too. But you should write to your congressman if you're in the US about airlines honoring, especially for veterans, for small animals. I understand if it's a giant therapy dog that then has to be under the area. Well, even then, and then it might be it needs to be trained, right? Because an emotional therapy dog has to be with you. A therapy dog for like a blind person also has to be with you, but it can be large, so the airlines need to make special accommodations for that. But for an emotional support animal, probably needs to be a small animal to get on an airline. So, but you know, there's compromises we can make with the airlines, but to just not listen to it outright. And a lot of airlines will listen, you know, follow it anyway, and get you your emotional support animal. You know, honor your paperwork, right? Because they don't want, you know, all the hate that they're gonna get if they don't. But a lot of the big airlines won't. I like the small ones like JetBlue and Southwest and Spirit, but a lot of the, you know, like American, I think is the worst airline anyone has ever flown. And they also donate to causes I don't believe in, so. Excuse you, young lady. That was not good. I think I'm gonna have her say goodbye, but I did want to have her say hello. And then we'll spend some time together. I gotta go put her away because she's not supposed to bite. So let's spend just a little time seeing if the emotional support animal theory holds up to the science that we have, and see if, even if you don't have a pet, if there's a way that we can incorporate this into your life to help with your depression as well. So as always, I don't know if you've been here before with me, and I'm in a little bit of pain today, so you have to bear with me. That's an IRL thing, that's not flavor text. You like the sound of typing? I don't always label all the triggers that I use in these videos for you guys, and then you don't end up finding them. is an article in the Psychology Journal about finding a standardized and comprehensive model for mental health professionals. Most of these are not studies. Emotional support animals, considerations for documentation, laws and ethics. Animal assisted activity. Here we go. This is a study. Finally. Legal issues. Alright, so one thing you can do if you can't find a lot of good data is on the left side of the PubMed page, and I hope you're doing this with me. Are you doing this with me? I can't exactly see your computer screen, can I? Okay. Do you have a pet that you like or that you have liked? Yeah. Oh, do you have your pen and pencil? Pen and pencil, pen and paper. I do think it's good if you try to always bring something with you to write notes down, you know? So you can write down your feelings as you're talking to me. I think you should. I think you should talk to me. Not just in the comments, because that doesn't help you, and comments are... The comment section of YouTube, I think, is cursed, but if you write in your journal, or you actually talk to me while you're watching this, it's a way to get everything out. Did you see the thing we did on writing previously on how it helps memory and emotion, like anxiety a little bit? Yeah. Yeah, I thought that was kind of cool. I think it does make a difference. But anyway, so on your computer screen, you should click, so on PubMed, after you've typed in emotional support animal not found exactly what you need, if it's all review articles and clinical guidelines, on the left side of the page, you can do clinical trial. And I'm going to select clinical trial. I'm going to also select meta-analysis, because those are good, and randomized control trial. And then we start finding things. Animal-assisted therapy for dementia. Okay, animal-assisted therapy with farm animals for persons with psychiatric disorders. Cats, that's not the same. Oh, this is interesting. This is about fibromyalgia, which I have. Evaluation of pet-assisted living intervention for improving functional status. Assisted living, residents with mild to moderate cognitive inhibition. Okay, so there aren't a lot of studies. Probably for obvious reasons. Here we go. Canine-assisted occupational therapy for children on the autism spectrum. Animal-assisted activity and emotional status of patients with Alzheimer's. And then emotional behavior outcomes in 4 to 6 year olds. Okay, so let's start with that study, and we'll kind of go through them one at a time. So the last study that we found is the study in Human Movement Science from 2015 October, and you can look this study up anywhere now, since I'm telling you exactly the most important stuff you need to know, which is the authors, the journal, the date, and the title. The authors' names are Jan B. Pieck, Robert Kane, and so forth. Excuse me. Yeah, I'm a little stuffed up today. I had a bit of allergies episode. And the title is, Does the Animal Fun Program Improve Social, Emotional, and Behavioral Outcomes in Children Aged 4 to 6 years? So it's a program designed to enhance motor and social development in young children, and its efficacy in improving motor skills was printed previously using a randomized controlled trial and a multivariate nested cohort design. That's nice. Based on the environmental stress hypothesis, it was argued that the program would also result in positive mental health outcomes investigated in the current study. That's cool. So they had 511 children, which is a pretty good number for a study. That's pretty cool. That's one of the larger studies we've looked at together, you and I think. And let's see how they rated them. Intervention control groups were compared 6 months following intervention, and again in their first school year. Changes in teacher-related pro-social significant improvement in prosocial behavior of children in the intervention group 6 months after initial testing, which remained at 18-month follow-up. Total difficulty is decreased at 6 months for the intervention group with no change at 16 months. This effect was present only for the hyperactivity and attention subscale. The only significant change for the control group was an increase in hyperactivity/inattention scores. From pre-intervention 18-month follow-up, the Animal Fun program appears to be effective in improving social outcomes. That's neat. That's really neat. I think I should save these studies in case I want to, I don't know, write a review article or something sometime. I do wilderness. Well, I'm working on my fellowship of wilderness medicine, of advanced wilderness medicine. And sometimes I'm on the lookout for different studies and stuff to do, or like review articles to do, looking at studies, and I think you could probably find something arguing for animal, I don't know, maybe not in the wilderness. Anyway, is there a study you've found that I haven't mentioned yet? Yeah. I see. I'm gonna just pull up this thing here. Control Shift X. Well, you see, I got signed out of my Google account, and I don't remember my password. I think it is a silly password. There we go. Okay. I'm a little dizzy and headachy. I was gonna record a bunch of videos for you today, but I think instead we'll just do the video for today, and then we will try again later maybe. But I do like spending time with you, and it was really, really, really important to me that we spend a little bit of time together. Whoa, this is way zoomed in. But are you done writing out that list of different animals in your life that have made you happy? Well, when you're in distress, it's helpful to remember happy things and happy times. It's kind of like that, you remember that Sound of Music song? Raindrops on roses and whispers on kittens. That song. Yeah, the favorite things song. I can't remember exactly. It was unmitted brown paper packages tied up with string. These are a few of my favorite things. When the dog bites, when the bee stings, when I'm feeling sad, I simply remember my favorite things, and then I don't feel so bad. And there's some truth to it. There's a little bit of truth to that. It really does help. You saw the panic attack video? Yeah, it really does help to kind of distract your mind from things, count your blessings and so forth. It actually also falls along with the gratefulness principle that helped Corrie ten Boom in the concentration camp. Everything's interconnected. Alright, let's look at our next study here. This is animal-assisted activity and emotional status of patients with Alzheimer's disease in daycare. Preliminary studies suggest beneficial effects of animal-assisted activities on behavioral and psychological symptoms of dementia, but data are inconsistent. This study aimed to assess the effect of animal-assisted activity with dogs on cognition, BPI this didn't work, you know. This is a small study. This is only 10 patients. And they did 2 weeks pre-intervention, 3 weeks control activity with fake dogs. Wow, that's weird. And 3 weeks of animal-assisted activity. They tested cognitive function with this. They tested a bunch of these different... they used these different questionnaires and tests that have been standardized. This was a... published in International Psychogeriatrics in 2011, August. Enrico Musello, Alessandro Ridolfi, and a bunch of other people were in this clinical trial. But it's small, it's only 10 patients. What's good about this study is that each of the batteries that they used, pretty standardized. They found that animal-assisted activity was associated with a decrease in anxiety and sadness, an increase in positive emotions and motor activity. But cognition and NPI were unchanged. What was NPI again? Oh, neuropsychiatric inventory. So, notice that they only did this for 2 weeks, and notice also this is only 10 patients. So, and it's difficult to control for. Maybe just having more attention was meaningful for them, right? There is some study for older folks with dementia, like if you have people with you and you're not alone, it's more meaningful. And of course, these scientists doing something to them for 2 weeks, they're not alone. So I'm yay or nay on that study. It's not a very good study. I'm not saying I could do better. I'm not trying to crap on their science. It's just not, it's not like those other studies that we were looking at. The other study with 511 children, that's pretty solid. On the other hand, the batteries that were used to test the Alzheimer's patients for these 10 were better batteries. Yeah. So this next study was in an autism journal. This was the Journal of Autism and Developmental Disorders. This was published 2020 November. And it was a randomized controlled trial called Canine-Assisted Occupational Therapy for Children on the Autism Spectrum, a pilot randomized controlled trial. And Jessica Hill, Jenny Ziviani, Carly Driscoll were the authors. So they had 11 patients, but in each group, so they had 22 children between the ages of 4 and 6. The oldest was 6 years and 11 months, and they were randomly placed either in the treatment group or waitlist control group. Results showed that although there was a positive trend for on-task behavior and goal attainment within the treatment group, results were not statistically significant. Okay, so, I mean, this was good. They published their results even though it didn't have the results that they wanted. Canine-assisted occupational therapy, they didn't find any evidence that it helped with on-task behaviors or goal attainment in these children. This makes a lot of sense because the only proven therapy for children with autism is ABA, Applied Behavioral Analysis. I actually used to that was actually my first training before I did medical training, as I interned with an applied behavioral analysis. You'd think I'd be better at dealing with people after doing that, but applied behavioral analysis center, because I wanted to cure my little brother from his autism. He had severe autism. Still has. He is 21 and pretty much nonverbal. Doesn't speak, he was smearing poo on the wall until he was 14. It was one of the heartbreaks of our childhood, was wondering what we'd done and whose fault it was. I dropped him once, and so I was afraid it was my fault. That's not what causes autism, but yeah, that was one of the traumas of young life, because he used to have all these nightmares too. He used to really and just scream in the middle of the night, and I remember being alone with him one time. Well, I actually, you can hear my whole story about him and how his disease affected my life and affected, I think, my terror. You can hear all about all of that at the emergency exit podcast podcast, actually, I did an episode about autism and the challenges growing up with somebody with very severe autism, and the challenges he had as someone with, I mean, severe, this is not talking, not associating, so I learned a lot about ABA because of that, and I was doing ABA therapy, actually. I got paid to do therapy, which is kind of cool. That was one of the coolest jobs I've had. More rewarding than medicine, to tell you the truth, but a little bit more stressful. Well, that's not true that it's more stressful. About the same stress. More monotonous, though. More rewarding, but more monotonous and less glamorous than medicine. So there is that study. Evaluation of a pet-assisted living intervention for improving functional status in assisted living residents with mild to moderate cognitive impairment. A pilot study by Erica Friedman, Elizabeth Gallek, and that is in the American Journal of Alzheimer's Disease and Other Dementias, 2015, May. And that says, so they did their study on 22 and 18 people in there. So 22 of them were bed assisted, and then 18 had a different treatment. And they found that the PAL program helped to preserve or enhance the function of the residents with cognitive impairment, but there needed to be initial study to see the duration and predictors' effectiveness of the PAL intervention. There's not a lot in this abstract. We really need to go into the full text, which is available. So again, it's kind of, but this is interesting. Physical activity, depressive symptoms improved more with the animals, and that's the thing, is I think that my gut, based on what I do know about the studies of these things, is that you're going to find more, you're going to find more benefit for emotional stuff. You're not going to find benefit as much for attention or, things like goal-oriented learning, or things like autism, or like the memory or cognitive functions of Alzheimer's. I think what's going to be important is emotion. I think that's where the evidence lies. Let's look at this study. I'm really excited about this one. This is a Mayo Clinic study, so you know that's legit. This is 2020 November by Stephanie Clark, Francois Martin, and it's called The Impact of a 20-Minute Animal-Assisted Activity Session on the Physiological and Emotional States in Patients with Fibromyalgia. And obviously, as someone with fibromyalgia, I'm very interested in that. And this is a large study. This is 221 participants. Randomized controlled trial. They were assigned either to the treatment group or the control group. They had 20-minute sessions, and they controlled for the person because they had 20-minute sessions with the therapy dog and handler, or 20-minute sessions with the handler only, which I think is smart. They controlled for maybe the person just felt better because of the other person and how the other person treated them, right? So to gain a better understanding, they used non-invasive physiological emotional biomarkers, including salivary cortisol and oxytocin concentrations, depending membrane temperatures, and various cardiac parameters, in addition to standardized mood and pain-based questionnaires. This is a good study. This is sexy. The results showed a decrease in heart rate, an increase in heart rate variability, an increase in well-being survey scores, an increase in salivary oxytocin, and a subsequent tympanic membrane temperature change, suggesting that participants in the treatment group were in a more positive emotional physiological state as a result of the session compared with the control group. And this is a good study. So this is a good study to save. And that they tested all those things. They had a large N. I respect that. I respect that a lot. So that's one to read all of if you get time. If you get time, that's one to really, really read. And again, Mayo Clinic is pretty trustworthy. Not everything everyone trustworthy says is going to be correct, right? Human beings are fallible, but that's pretty good. Is this a study too? This is not a study, even though I only asked for studies. This is a review article. And this is a meta-analysis. Good. This is a nice big meta-analysis on animal-assisted therapy for dementia. That's good. So we'll take a look at that. Dementia. We know what dementia is. Telling us what dementia is not helpful. So they found a bunch of randomized controlled trials, cluster randomized controlled trials, randomized crossover trials, comparing animal-assisted therapy versus non-animal-assisted therapy, live animals versus alternatives such as robots and toys, or animal-assisted therapy versus any other active intervention. They used the standard methods of Cochrane dementia, and they expressed their results using mean difference, standardized mean difference risk ratio with 95% confidence ratios when appropriate. Neat. That's good. They included 9 RCTs, all done in Europe and the US. And they go in a lot of depth in their abstract, their main result. Wow. And wow, they really went into this. Is another one to really look into and actually read the study of. This is a great meta-analysis. I mean, you have, a combined 305 patients, then 164 patients, 143 patients. So they're able to, one thing that a meta-analysis is able to do is it's able to increase what's called the power. Power is an equation that actually has n in it, so power is bigger when n is bigger. But power is kind of like, you can think of it as the strength of the study. You can think about it that way. That makes sense, the word power. And power improves with n. And n improves when you can group multiple studies together and take all their small numbers and make them big. But the advantage of, starting with good studies like these guys did, they only included 9 of the ones they were looking at. And they included larger studies and they grouped them together. Then they were able to compare. They basically, I could not do a meta-analysis because I don't have that level of skill with biostatistics, right? I would make a mistake and then publish something that wasn't necessarily true. But you have to use your skill. You have to use the meta-analysis information, basically. You take the biostatistics and basically reanalyze all of the results together, kind of as if it was one study. It's really, really cool way to do science and take the data we have, and it's kind of low cost. So their conclusions were they found low certainty evidence that animal-assisted therapy may slightly reduce depressive symptoms in people with dementia. We found no other evidence that it affects other outcomes in this population, which that's what I said. I think you're going to find stronger evidence for the emotional aspect of things. I don't think that you're going to find very good evidence for non-emotional interventions. People will say things like that their animal can cure cancer and stuff like that. I don't think that we have evidence for that at this point. That doesn't mean it's not true, it just might mean we haven't got it, right? And then they also did psychiatrically hospitalized children with autism, social communication behaviors. So that's cool. This is 142 youths. This is another good one you should look up if you want to. It's in the Journal of Autism, the International Journal of Research and Practice, 2019, October, by Monique M. Dermone, and it's called Animal-Assisted Activity Improves Social Behaviors in Psychiatrically Hospitalized Youth with Autism. So, that's something I saw, actually. My little brother really lit up after he had horseback therapy. But, again, I don't think it's necessarily going to cure autism. Even this study just found that it may improve social communication behaviors in people who are hospitalized. So, people had more positive emotional facial expression use of gestures and looking at both adults and peers. That's cool. That's really cool. That's how my brother was after animal-assisted therapy. This is a review, not a study. We wanted to look at studies. And then this is a clinical guideline helping us providers to understand the laws, thorough valid assessment of the individual requesting an ESA certification, and so forth, all the rules. So, you can actually Google emotional support or animal certification, and you can actually find online therapists who will evaluate you and see if you qualify. So that's something to consider. Now, what if you don't have a pet? You can still get the benefits from animals, even if you're not a big animal lover. And a lot of different kinds of animals can help, bring you some joy. Remember at the long time ago, I think our very first visit together, we talked about how the opposite of depression is activity, and you scheduling one outside activity this week. Well, I'd like you to go back to that, and I'd like you to think about choosing one with an animal. So maybe it's going to bird watching. Google bird watching guidelines and go bird watching. Or maybe it's going to the zoo if it's open and safe near you. Or maybe it's going, I used to go to the pet store and watch the fish. Okay, maybe it's that. Maybe it's something more intense, like what if this week you set up to go volunteer at the animal shelter? That's an option. Or you pet sit for somebody who you care about. Those might be a little overwhelming for you. If you are struggling with a lot of depression, so you could start little first. But, on the other hand, sometimes it's good to rip a Band-Aid off, right? Yeah. So those are things to consider. So bottom line is there is some evidence that helps with, that spending time with an animal helps with some of your emotional functions, right? Especially if you also have a pain condition. Why is that? And why is the evidence going to be better for that with a pain condition or something like Alzheimer's? Well, because a pain condition is benefited a lot by distraction, right? By distracting from the pain. It kind of becomes a mind over matter situation, whereas in Alzheimer's or even autism, there's something actually wrong with your mind. And that can make that aspect of things difficult. It's hard to outthink your inability to think, right? Which is again where the emotional aspect of Alzheimer's is where the evidence is. There isn't really evidence for cognitive improvement with animals. Anyway, from what we've seen, I'm sure you could do a lot more research, but you saw also there weren't a lot of studies when you looked it up. We've done other searches before that came up with many, many more studies than we were able to find this time. And then, what else? And then of course with autism, it makes sense that we wouldn't, we would, I thought it was interesting, we had some conflicting stuff. That large study did find some benefit from, like, people were starting to have social, pay attention to social cues, and smile and everything because of the animal. That's kind of cool because it can be like a tool, right? An intermediary tool. I mean, I've heard of kids with autism having a lot of benefit from talking to Siri because it's somebody that they can practice the difficult part of life, which is social interaction with. That said, it's not, again, there's not like this solid evidence for it like there is for like ABA or something like that. So, but yeah, so try those things. Go find an animal this week. Go spend a little bit of time with an animal. Pay attention to it, watch it, learn from it, be kind to it. Just enjoy that simpleness. Yeah, and if you have a pet, do something a little extra special this week, a little out of the norm. Yeah. I really hope that helps. I do like trying to find the evidence behind stuff and see what we can find to help you out. Alright. help with the sponsorships if you are able to do that, and of course you know that's good for your mental health. Helping somebody else. There's almost nothing better. Yeah. Especially like that, helping someone far away who's not trying to oblige or hurt you or anything like that. I think sometimes people in our lives can put a lot of pressure on us, but helping like a charity or helping a cause can alleviate some of that pressure. People tend to be kind of demanding. Yeah. Well, thank you for being here and spending time with me. I hope that this was helpful. Alright. We'll spend more time together. We're going to be doing more depression videos and sci-fi medical exams. It's kind of going to be just the main focus. I think I'm kind of done with everything else. We'll do more historical medical exams too. Gotta really focus on those kind of things. Oh, and I have a big bunch of wilderness medical exams coming up for you, like fun rescue type stories based on my wilderness medicine